is recorded now. Cool. Okay. Yeah, so I guess we'll just start. So I didn't realize that like counseling and therapy were so similar. I thought that there was like more difference between them, which I didn't realize. So that was kind of cool. And yeah, I guess the biggest difference were just the like therapy goes more in depth, kind of more long term, whereas counseling, like you said, was more like surface level, more guiding and more like a specific problem, versus where therapy was more like a long term illness.
Yeah, I had a similar perspective that you did because I've been like, well, because I'm very interested in school psychology
Mm-hmm.
for a grad school program. And I was like, well, what's the difference between school psychology and like a counselor, like a high
Yeah,
school counselor? And when you Google it, there's no definitive answer.
right.
Obviously, they have different jobs. When you look at their job titles and what they do different things. But yeah, for the most part, what I took away from the book was that therapy is more in depth than counseling, and I don't know, it can cost a little bit more. The book referenced that, and I think Dr. or Professor Butler referenced that
Yeah,
too.
I agree. Yeah. I've done like therapy before. I've never done counseling. I guess there's not much difference, but like I haven't like personally seen the difference between them.
Yeah, precisely. Neither have I. Just read about
Yeah.
it.
Let's see. Yeah, so when it comes to theories, so um, theories, why are they good and bad? So theories help. What do they do? Where it's,
Or I can take it. I can
yeah.
like if you want me to describe them. They're like a theory from what I was able to read about. Theories are comprised of knowledge on a particular topic, and then they use the theory to build on it. They build hypotheses and stuff. They build hypotheses off of theories. Theories seem to be pretty general.
Yeah.
I think that that's why they stress that they could be dangerous and possibly susceptible to bias because they're built around social norms.
Mm-hmm.
I liked when Dr. Butler was discussing like Freud and how Freud, a lot of his theories were they said like when you what's it the sexual triad, when you read about the sexual
Mm-hmm.
triad, it's like weird, but when you think about that time period, it
Yeah.
makes sense.
Makes sense. Exactly.
Mm-hmm.
Yeah, no, I kind of saw it was I mean, I agree, like I have the same opinion as you, that they can be biased. And also when you have a theory, it helps you kind of stay on track and kind of have an idea. But at the same time, I feel like if you're so stuck on like that theory, then it could prevent you kind of from seeing like outside that box potentially, as
Right.
well.
Right. And I think that another important takeaway from that is the fact that while the theories might be outdated and they're based on particular social norms, they still like bring important information to the table. I mean, pretty much a lot of psychology is built on Freud and what he did,
Right.
despite what he did, you know what I mean?
Yeah.
Despite the time period that he did it in.
Right. But like if they didn't have him, then they wouldn't have been able to like build off that and like have like different theories than what he had or whatnot or agree with his and
Exactly. Exactly.
yeah.
And
I noticed he didn't really touch much on like the effect size. I don't think he did, unless I missed that. But
yeah, so I read up like in the book, I just read up on
yeah,
a little bit about effect size. Uh it
because the effect size is like it basically shows like how much difference does the treatment make. And so as I was like reading and looking stuff up, it can be negative because one, there can be a bias based on like the sample and like the participants that were in it. Um, and then there also can like be a measurement of error. And it doesn't
mhm.
really show like other factors outside of like it made a difference.
Well, what I read what on in regard to why a therapist shouldn't obsess over it
Hmm.
is because an effect size of 0 would mean that the average person would be better off than 50% of the people that didn't receive treatment. So even obtaining no effect size you can still get people better with no effect
Right.
size.
That makes sense. Yeah.
I thought that was one of the more, I don't know, I thought that was probably the crucial takeaway for that
Yeah,
point.
that's a really good point. That makes sense.
Um,
Um,
and then
the consent.
so
Yeah.
I I have the digital text so I can like look up particular things if I can't find them. And I couldn't find anything on how do you pronounce it?
Assent,
Assent,
is that what it is?
assent.
I had to look it up online. So what it is, it's like, let me see. I actually wrote it down. So it's an agreement when someone can't make like can't give legal consent. So I'm assuming it's like if you're either underage or for some other reason you can't give legal consent, it's still that like agreement between like the therapist and the client or whoever
Yeah,
the two people
that,
are.
that's pretty on par with what I read too.
Okay, cool.
Uh,
I never
I
heard of it before.
yeah, I would assume that I would have heard it
Yeah,
in like intro to what is it, lab methods class, but
yeah,
I never heard of assent. But yeah,
neither.
from my understanding, assent is what you give to somebody who's underage or doesn't have the mental capacity to agree to informed consent. And basically, it from what I know, it's the same thing as as an informed consent. It's just
Yeah,
um changed in a way that the person they're giving it to can like accept it.
that's
But
what
then
I got to. Cool.
I also read that informed assent also requires informed consent of the legal guardian or parent too.
Oh, yeah, I guess that makes sense. Okay.
Yeah, yeah. But I was like, yeah, I was curious about it myself.
Yeah, I was like, I have no idea when I first saw the paper what it was. But yeah, obviously informed consent is very important. If you don't, if you neglect informed consent, obviously it can go anywhere from like up to having like legal problems or losing licenses and things like that.
Mhm. Mhm. Yeah, and that's what yeah, that's what I read too. You can like lose your license if you don't give informed consent. It's pretty much required
Right, and I would
from my
assume like
understanding.
I would assume in some cases if like someone was running a trial and didn't have informed consent like for all the clients, it probably could like discredit the
Oh yeah.
like the study or whatever probably.
Yeah, yeah. No, no, for sure.
And I feel like just ethically, like the client or patient should have consent for whatever is about to happen or whatever therapy they're going through, just from like an
Absolutely.
ethical standpoint also.
Absolutely. Yeah. And
And then I guess going along with consent and having that like trust between a therapist, having a therapeutic relationship is obviously super important.
yeah,
Um,
I thought that the statistics on relationship and then also expect a patient expectation on
mhm.
the statistics on um patient outcome. I thought they were very interesting
Me too.
for the therapeutic relationship. It was like it accounts for 30% of treatment outcome, and then for patient expectance, it's 15%. I thought that was really
Yeah,
interesting.
I didn't realize they were like that high. But it makes sense. So like for me, a couple years ago, I was doing just like one-on-one therapy and I did not like the therapist at all. And that was like the reason I was like, well, I'm done doing this. I
Yeah.
don't like this, like we don't connect well. I don't have like trust with this person. And then last year I started doing like couples therapy and like the reason we've made progress, or I guess right, a good reason, like a big percentage why we've made progress is because of the therapist that we have, where we just like trust her and can talk to her, whereas it makes all the difference.
Yeah, and I think that's what like Dr. Butler
Mhm.
was trying to get across is that you have to like I like that he said like you basically have to sell yourself. Like you
Right.
have to sell yourself to essentially a customer, I guess.
Yeah.
But I don't know, I thought that was interesting just because like I don't know, I'm in sales and all I do is sell stuff. And
Yeah.
I was like, that's pretty cool. Cause you're right. Like you sell yourself. You can sell yourself to build a relationship. You can make
Oh yeah.
trust if you sell yourself, if you like paint yourself in a particular picture. And
Right.
I think that's what he was getting across a lot throughout his lectures, that he like turns
Mhm.
into a different person when
Yeah.
he's being a therapist. And I think that have to like build a relationship and
Yeah.
build boundaries for patient success. I don't know, I thought that was cool.
I really like that he's like has so much experience with different therapies and that he's a therapist. I think it makes like connecting the like the personal side to like the information makes such a big difference when he's able to like talk about his
Mm-hmm.
experiences. I think it makes it so much better.
No, yeah, I really enjoy when he brings up a real life oh, what's the word? When he brings up a real life example,
Experience. Oh yeah,
an
example.
experience, a particular experience that like relates to what we're talking about. It's, I don't know, it helps me paint the picture in real life, I guess.
Me too. Yeah. No, but I get it because like I'm in HR and even though I'm not like I don't have to change too much, it's still we have people coming in for all different reasons and like sometimes I have to be more strict, sometimes I have to be like a little more caring or a little more like empathetic and it really makes a difference. Like when I stepped into the HR team, some of the members of HR had like the staff didn't really like them and they're like really like kind of cold and stuff. And I had to like to spend the first few months I was there really just like building connections and being like, hey, we're not like scary. We can actually be nice and have a good conversation with you and stuff. So that makes sense.
Mm-hmm. And that builds success,
Yeah. Yeah.
obviously. Oh, that kind of plays into the multiple roles thing, right? I'm not
Yeah.
skipping. Yeah, the with the like selling yourself and creating boundaries. Like I that is something that's something that I never really considered was the multiple roles dilemma. Um, but it makes sense. Like
Yeah, me either. I never put
once
like thought
you
into it.
yeah, once you have a personal relationship with somebody, it can be hard to break or I guess build back up barriers to create that patient therapist relationship to, you know, provide good patient outcome. You know what I mean? And
Yeah,
so
I
I could
agree.
totally see how it would be really problematic to give like your brother or a relative or some one of your friends therapy because you have to have
Yeah. I feel like there
position.
were in some at some moment during like the like that while they're in therapy, I feel like something would like there's so many chances for something to come up that would become unprofessional or like step over boundaries or like a client like the patient feel like either
Or
does like
even
gets mad at them or there's some sort of like almost like kind of wants to cross the line. There's like just so many unethical things that could end up popping up.
or even confidentiality. Like it could become an
Yeah,
issue if you
that's a
guys
big one, I feel like.
hanging out.
Yeah, definitely.
um, did you take the assessment on
Yeah, I
page?
looked at it and I like scored through most of it. I'm actually gonna I'm gonna pull it up on my computer.
So what I noticed was that I happen to be a fan of a lot of the behaviorists and the
Mm-hmm.
cognitive behaviorist theories. I mean, there's definitely merit in all of the other theories. That's why I mentioned, um, or hold on. Yeah, yeah. I was definitely I tended to like more of the cognitive behavioral theories and the
Yep.
behavioral theories. They make sense to me. Like there are aspects of all the therapies that I'm drawn to.
Yes.
I think they all, each theory has an aspect about it that is important and that is
Yeah.
true. That's what makes it a theory. But I was really drawn towards the what is the word?
The behavioral and cognitive behavioral, or
What's that? Yeah, no, cognitive behavioral. Like that's what I'm talking about. But I thought the integration, like slash electric theories, were interesting because I throughout my education, I've like learned about all these theories, and I've always been like, well, how do therapists like pick and pull? Because I when I hear my professors talk about it, I hear them pick and pull what they do in real life.
mm-hmm.
But how do they actually go about doing this? So I thought it was really interesting to learn a little bit more about the integration and electric theory just because it wasn't talked about that much in the book. I went and researched a little bit about it.
Yeah, no, I had the same. My top three were behavioral, cognitive, and the integration one. I like that, like where it says like no single theory is viewed as more correct or inherently better than the other. It really depends on what's the problem, what are you trying to change, like what is going on, right? And then you
Yeah,
obviously apply the most what you hope is the most beneficial theory or therapy. I mean,
I like it because it seems very adaptive. It seems like you could pick and choose particular things that are going to help a particular person the
Hmm.
most. You know what I mean?
Yes.
I think that's really interesting. And if I was to become a therapist, I think that's how I would go about doing things. I think I would keep most of it with cognitive behavioral therapy, but I would definitely pick and pull from other ones like but yeah, I would pick and pull from other ones for
Yeah.
sure.
Yeah, my other top, yeah, so I also had behavioral and cognitive. So I worked at a behavioral health clinic for kids with autism, and we literally did like behavior
That's
analysis,
awesome.
like therapy, which also had like cognitive behavior therapy. So I just like have a lot of experience with that and like how to, what's the word, like apply that like correctly and ethically and um like with the clients that we did have, even though I did, and then also even though I didn't like family systems therapy, the class, I do really like a lot about that, about family systems therapy. The therapist I have with my partner right now, she like integrates a lot of it because we both didn't really realize like how many things were coming into like our relationship that had to do with our like own pasts. So I see a lot of like family um, therapy. So I also like a lot of stuff from that.
Yeah, I personally haven't, for whatever reason, learned very much about the field of family therapy, but I'm taking that same class, and
Yeah.
obviously we haven't gotten very far. But so far, what I've read is interesting because it's making me take a different perspective than I usually would. Like we're talking about IPs and symptoms and how
Hmm.
they're not isolated, basically
Yeah.
to the person of interest,
Hmm.
and that was approaching it in a family matter like that wasn't something that I would usually do because I like
Yeah.
cognitive behavior therapy.
Yeah, I know they're kind of contradicting in a way, but but then I see them right, like they would be used for completely different kind of issues at, in some way. At least for like the two ways that I've experienced family systems therapy and cognitive or behavioral therapy, like they've been for like very different like populations. So I see like both sides, whereas I don't know, like obviously flipped, like they wouldn't work for the other, really. Um, that makes sense. So, but yeah, there's a lot in family systems therapy. Uh, go over a lot of different theories or a lot of different therapies. So that was kind of cool. I learned a lot. I didn't really, because I never really put much thought into like therapy, honestly, like the different types of therapy until I took like family systems therapy. And I was like, oh my goodness, there's a lot.
Yeah, and that's kind of what I'm talking about. I haven't gotten that much into it. I'm
Yeah.
excited too, though. But yeah, I,